thank you. Valerie, thank you for inviting me. I look forward to the next 5 days of working with you. I'd like to start by just asking people for their different backgrounds. So I know there are people here who are physicists, engineers, and at least one veterinarian. Other professions? Dentist. How could I forget? Pharmacist.
Biologist. Chemist. We have a few chemists.
Chemist. I don't know. Physicians. Bio doctor. What's a bio doctor?
Bio No. It's the people that do all the clinical exams and everything. They work in laboratories.
Okay.
So
this is a very broad group of people. Oh, okay. Yeah, you told me, but I wanted to. So let me, just in terms of practicalities, please tell me if I'm going too fast or too slow. Please tell me if my English is too bad. And please tell me also if you would like to increase or decrease the amount of physics, more biology, less biology, more medical, less medical. This is your course, so I can change to suit. I'd like also to ask you perhaps for Friday, for the last day, to provide topics or questions which you would like to cover that I haven't covered, so that you get what you want. So perhaps just write down the topic, and then I can see if I can just, as you think of a topic you would like to cover more, just write down, and then I can try to find some material for the last session so that we can have that discussion from you. I will give a research seminar on Thursday, which is more a summary of the work of our own laboratory. So there will be some more detailed information on some of the topics there. So I invite you to visit that. So I'm going to use slides or PowerPoint. And if we can, oh yes, we have to take the cover off. So I thought I'd start with a tourist slide. This is not Canada. This is Scotland, where I come from. I show this slide because it's very beautiful, but also it has an optics question in this slide. And the question is, you see here, this is the lake, and this is the Rio. So why is this clearer than this? The reflection is more clear, more crisp than the original. So I will give a prize for the best answer at the end of the course. Professor Magnato is not allowed to win the prize. So the overall topic is biophotonics applications, mainly in cancer diagnosis and treatment. And I just give you, if you want contact information. Valerie, can we perhaps print out these and give people copies? Okay, we'll organize that. So we'll get copies of the material. So I thought I'd start today by giving an overview of biophotonics, not just cancer, not just cancer, but an overview. And then the next lecture, I'll start with photodynamic therapy, the basics, and then photodynamic therapy, more applications, Then switch to diagnostics. And for the diagnostics, I'll talk about principles and specific examples, mainly cancer. And then the last lecture, I would like to have mainly open discussion. So what topics which you identify, but if there is not enough material, I will talk about photonics applied to analytics in biology, and also talk a little about nanotechnology with people. I'll talk about this also a little in my seminar. And I can change any of this. So if you want something different, if you want to have a lecture on history, then I can do that for 1 minute. So today, overview of biophotonics. Please interrupt if I go too fast or you have a question. And today I will not be specific to cancer, because I thought it was important to give you an overall broad understanding. So first, what is photonics? I think most people here are familiar, but photonics is the science and technology of light, how it's produced, how it's transmitted, how it's measured. And here we will define light as ultraviolet or visible light or infrared light. This is the optical analog of electronics. So people talk about photonics as electronics with light. And it's, of course, a very old science, starting perhaps with Isaac Newton. So now, many hundreds of years later, we still do optics, but now we call it photonics. And I just put together this group of pictures to illustrate the fact that photonics is everywhere in modern society. So a CD player is a photonic device. This is an optical storage device. Entertainment, of course, military. An example of infrared camera for sighting. Manufacturing, this is use of high power laser for welding. And we'll see an example later today of welding of tissues with light. Environmental monitoring, for example, aerial monitoring or underwater monitoring, and data security and storage. And there are other, for example, in agriculture and so on. So biophotonics, then, is the application of photonics to life sciences and medicine. And I wanted to identify why we are now doing light. 20 years ago, 30 years ago, this was a very small topic. And now it's a very large topic. And I thought I should ask the question, what is it? What are the properties of light that make it valuable for use in life sciences and medicine? And I think there are really three fundamental properties of light. You may think of more, and we could have a discussion about that, but three properties. One is the photon energies. If I look at this red light, the energy of the individual photons corresponds to molecular energy levels. How do we know that? Because we see colors. So Christina's top is green because the light is interacting with the molecules, changing the spectrum from the molecules, and so is interacting at a molecular level. If you compare this with X-rays, for example, X-rays don't care about the molecular structure. So you cannot see color in X-rays, but in light you can. The wavelength, of course, is similar to the size of cells or ultrastructures. And these two are obvious. And perhaps the result of that is that you can therefore probe for diagnostics and analytics. You can probe molecular processes. You can image at small scales. But less obvious is this third one, which is at 1 watt, is 10 to the 19 photons per second. So 10 million photons per second. And with modern detectors, you can detect 1 photon. So this gives a huge range of sensitivity. So you can detect 1 part in 10 million per second. So this gives ultra sensitivity. So these three together are really the reason why biophotonics exists. Does anyone have questions about that? It's really obvious. Okay. Similarly, if you go onto the internet, the internet is a great place to find information. You go into internet and go to Biophotonics. This is a magazine. And I just selected a whole range of different examples. So here is optical imaging of the breast, bioanalysis, fluorescence imaging, laser microdissection, using laser to take a tiny sample of tissue from a slide, optical imaging of the eye, I'll talk about that, measurements in the brain, treatment in the eye, biosensing with gold nanoparticles, for example, here. And here's a 3D fluorescence imaging of embryos. Laser tweezers for, this is an example of single molecules of DNA. So the DNA molecule is stuck at one end, and you can pull it with a laser to measure the force required to pull a single molecule of DNA. And there are, this is interesting to go here because you find many very nice examples. So the main fields of application in biophotonics are clinical therapeutics and diagnostics, analytics. So the difference here is these are measurements or procedures done in patients, human or animal patients. Okay. This is really measurements done on samples, blood or other cells, samples of tissues. And then there are many different tools, diagnostic and analytic tools for biology and biotechnology. And if we have time on Friday, I can talk about some of those. This is biomedicine, biotechnology. There are also now areas of application in terrorism, very important in North America, Europe, maybe less important in Brazil, I don't know. Yeah.
Well, the Argentinians.
Oh, the Argentinians. Yes, do take some water. Environmental monitoring and food and agriculture I won't deal with. I thought I'd just show one example of this. This is a small device. You see it here, which has a portable analyzer for nucleic acid. So when 9/11 happened in the US, and then there were some threats of anthrax, for example, the US government did a contract to Lawrence Livermore Laboratory to make a handheld detector for detecting pathogens. And in about 2 years, they went from nothing to this, which is an incredibly complex device, which has fluids, electronics, optical readout, etc. So if you throw enough money at this, you can make incredible progress. But just to give you an idea, that already, at least for biodefense, this sort of portable device exists that can do in a handheld what 2 years ago would be the size of this bench. So a remarkable technology. In these lectures, I'm going to concentrate on clinical therapeutics and clinical diagnostics. So let me start with therapeutics. So here we want to put light into tissue and make a difference, cause and effect, a biological effect from absorption leading to changes which will produce a clinical benefit. This is a schematic diagram showing light going into tissue, multiply scattered, which is what you see here. And then it can be, some of the light can be re-emitted from the tissue, which is what you are visualizing at the moment. It can be absorbed and produce fluorescence. It can be scattered with some loss of energy, a technique called Raman, which I'll talk about. Or for therapeutics, the important thing is that the energy is absorbed. So a basic principle is if you want to produce a biological effect, you must absorb energy from the light. Just historically, this was used 100 years ago by Niels Finsen, who won the Nobel Prize in 1903 for medicine. First photomedicine practitioner. And he won the prize for for work in use of light to treat. So he used to have his patients with mainly skin disease in the clinic in Copenhagen out in the sunlight. Two problems. In 1895, you were not allowed to take your clothes off. Which is a problem with light. Okay, so you see all these people are fully all dressed for light treatment. And secondly, of course, this is Denmark. So for 9 months a year, there is no sun. But he still won the Nobel Prize for that work, so that's pretty impressive. I show you this. This is in the Dead Sea in Israel. In the 1950s and 60s, the German government would pay for patients to have a vacation in Israel if they had certain skin conditions, so that they could go to the Dead Sea. The idea would be absorb minerals from the Dead Sea, be exposed to the sunlight, and treat the skin condition. They don't do that anymore, unfortunately. When lasers were invented when were lasers invented?
1960s.
Yeah, 60, 61. Okay. So this is just 2 or 3 years later, was the first uses of lasers for medicine and surgery by Leon Goldman, shown here. This is the laser. It's a ruby laser. And Goldman was still active until maybe 5 years ago when he died. So he was still treating patients when he was 90. So the invention
was mainly ablation of
mainly surgery, mainly using lasers for cutting. Yeah. Now, if you look at this area and just look at laser-based techniques, with modern equipment, you find a big list of different applications of laser. So surgery, prurotherapy, photodynamic therapy, welding, using lasers to enhance the uptake of drugs in the eye, the cornea or the retina, the skin, etc. So I'm going to show you some examples of these. Again, don't worry about writing all this down. We'll get you copies as we go. The purpose or the advantage of using lasers in this way are they give you precision, very precise delivery of the light. You can do with optical fibers, you can do it minimally invasive, you can go inside the patient, and I'll show you it can be very selective in the effect. So, with all of these techniques, the big challenge is how do you give the optimum treatment? What is the optimum conditions for getting the particular effect? You can't just take a laser and use it and hope that it will work. So if you look at this at a fundamental level, there are a number of different types of interaction that can be used. So basically, remember, you have to absorb energy to produce a treatment effect. Question is, when the energy is absorbed, what does it do? And so it can heat the tissue, can cause heating for thermal effects. It can produce chemical changes, can produce mechanical changes, electromechanical changes, and I'll put here biostimulation separately. That may be part of that. It's a little controversial. Which one of these effects happens depends on the wavelength and the exposure. So if I take this laser, I can hold it forever, and I will never cut my hand, I hope. Okay? Because there is not enough energy, not enough power to produce photothermal. Is it producing photochemistry? A little bit, maybe. Yeah? No. Is producing biostimulation? Probably. Mechanical, electromechanical? No. No. I hope not. Yeah. Okay. So if I took this laser and instead had a blue laser at the same power. A blue laser. Okay, so now, oh, thank you. You're a perfect student. Okay, so again, I change the wavelength. Will it change these? Thermal? No. Chemical? Maybe different. Maybe different. These? No. Biostimulation? Probably. So, how do you turn this off? Okay. Can I keep this for a moment? So these interactions depend on the wavelength and the exposure. This is a complicated question because of the following. So this is a plot of the absorption against wavelength for different molecules in tissue. So here, for example, we have the absorption spectrum of water. You see, this is the visible part of the spectrum. This is ultraviolet, infrared. So you see the absorption of water is very low in the visible. How do you know that from normal life?
You see things, right?
Yeah, I can see you.
Through water.
You go scuba diving, right?
Well, the eye is a ball of water.
Yeah, and the eye is a ball of water, yeah. So the absorption is very low, of water is very low. in the visible. However, if you go to the infrared, the absorption of water becomes very, very high. And similarly, the UV. This is the absorption spectrum of blood. And I'll come back to this in more detail. Again, the absorption is very high in the visible. So if we take a bottle of blood, it's dark, dark red. Okay? So very high absorption in the visible. So if we have a beam of visible light going through a material that is transparent, where the absorption is low, the penetration is very large. On the other hand, if this was a bottle of blood, and I put this laser, you wouldn't see anything. So the different absorption gives you different penetration of the light into the tissue. So at some wavelengths, the light penetrates only a small distance, at other wavelengths, a large distance. So that's the first fairly obvious point. The second point is not so obvious, and I'll show this slide several times. This is a plot of the power density, the number of watts per square centimeter, so how much power is incident on the tissue, versus the time for which the light is on. Now, I note two things here. One, this scale is logarithmic, so this is 1 watt per square centimeter. This laser is maybe 10 milliwatts per square centimeter, down here, a little more. This goes up to 10 to the 12, a million watts per square centimeter. That's like taking the power of the sun, all of the energy of the sun that is hitting the earth, and concentrating it on 1 square centimeter. So it's a huge power. So we go from this to taking all of the energy of the sun onto my hand. You would expect something different to happen. Here, this is 1 second. This is 1,000 seconds, 20 minutes. A millisecond, microsecond, nanosecond, and so on. So again, this is logarithmic. The surprising thing is if you plot all of these different interactions on this scale, they all lie along roughly this line, within a factor of 10. But as we go to higher power and shorter times, you go from stimulation to chemistry to heating to mechanical to electromechanical. So if I take 10 milliwatts for 20 minutes, so that would be like my standing here for 20 minutes. I will only produce modulation or stimulation. If I take the same total energy, so you measure total number of photons in 20 minutes, and I give that in, let's say, 1 second or less than a second, I will produce thermal effects. So I take the same energy, but now I deliver it over a much shorter time. I will produce heat. I will burn my hand. Okay. Same total energy. If I take that same energy, but deliver it in a microsecond, a millionth of a second, I will produce explosion of the tissue. And if I deliver the light in a thousandth of a millionth of a second, a nanosecond, I will produce a plasma in my tissue. So the same energy delivered over short times goes from very, very low level effects to really extreme effects. And I'll show you some slides of this. This is just to illustrate the transmission of different wavelengths in the visible. You see going from blue to red, you have more penetration, but also you notice, and this is important for treatment and diagnosis, if you look in the red, you do not see the blood vessels. This is all the light is coming through. If you look in the yellow or in the blue or the green, you see the blood vessels. And this is due to the fact that there is a specific absorption of hemoglobin at those wavelengths. This is a plot on the same idea, but this time with different, the water and the whole blood, just showing where different types of medical laser lie here. The neodymium YAG laser used, I'll show you examples at around 1 micron, the excimer lasers in the ultraviolet, the holmium YAGs out in the infrared, CO2 way out here. So different medical lasers are really accessing different parts of the tissue. So if we take a CO2 laser for cutting, almost the only thing that matters is the water content, because the other components are very low. If we take the excimer lasers, then the water is important, but also other tissue components. Now, of course, a particular tissue, like skin or muscle, is going to be a combination of these different chromophores. So, for example, the amount of water in the epidermis is not the same as the amount of water in the liver. So if we take a CO2 laser, we expect that the rate for cutting of that tissue will be different with that laser. This means that these are values of the penetration depth. So if we go to the CO2 laser, in the infrared, if I take a CO2 laser and put it onto my hand, the typical depth will only be 10 microns. So very, very superficial. If I go to the ultraviolet, again, very, very superficial. And we'll see why that's important. If I'm in this region here, 700 to 1200, if I go back here, oops, sorry, go back. This region here, the water absorption is very low, but also the absorption of hemoglobin is very low. So the penetration of the light is very high. So we get penetrations of 2 to 10 millimeters instead of 10 microns. So 1,000 times the penetration. Okay, so now I'm going to take you through each one of these in turn. So we start with photochemical. And I will talk about PDT tomorrow, so I won't spend much time on this, just the examples. So here is the use of photochemistry for treating these little guys. So many new children, young children, especially if they're premature, have jaundice. Everyone know what jaundice is? What's the Portuguese? Okay. I won't try to say it. Yeah, so this is bilirubin. So this is a pigment produced in the body. And premature infants often accumulate bilirubin because the system is not fully running. And this is damaging. It can cause brain damage, for example. And so these, you can destroy the bilirubin with light by photochemistry. So this is a bilirubin molecule, and you apply light, and it basically changes the structure of that molecule so that it is not harmful and can be cleared. And the way that is done is just to have the baby, you can get a blanket, a wraparound blanket, or this sort of device, or the incubator, if the baby is in the incubator, can have this, and this is blue light. Here is so-called PUVA, which is photochemistry. This is sorolin and ultraviolet A. So sorolin is the drug, and UVA is the wavelength. This is for treating skin conditions. This is psoriasis, which is the cells in the skin are replicating, duplicating too fast. And you get these areas, especially on the joints, on the elbows and knees. Is this a problem in Brazil? Yeah, yeah.
And we treat it here too.
With PUVA
With
or PDT?
blue LEDs.
Oh, blue LEDs. Okay. So this is PUVA. This is vitiligo, which is abnormal pigmentation. And you can get chambers to do whole body ultraviolet or these types of device for hands and feet. The chemistry, this is the photochemistry. So this is the drug. It's called 8-methoxysorolin. And what happens, this is a residue in DNA, thymine. What happens is you give light, and basically the sorolin molecule slips in to the DNA chain. So we have the DNA spiral, and with the light activation, the sorolin molecule goes in to the DNA so that the DNA cannot separate. So it prevents the cells from replicating. Photodynamic therapy generalizes that using drugs to treat specific conditions, and I'll come back to this tomorrow, so I won't spend more time on that. Photothermal, we go up in the power density to perhaps 1,000 watts per square centimeter. Now there's fundamentally two different ways to do photothermal. One is you cook the tissue. This is like making hamburger or steak, but when you cook a steak, the steak is still there. Right? It's supposed to be still there. Okay. So you're not exploding the steak. You are coagulating it. The collagen is cross-linked, and that basically is cooking, and it depends on the temperature. So this is an example of tissue that's been cooked with a laser, and you see this region of coagulation. If you go more than 100 degrees, water evaporates, and so the cells explode. And if you go to 300 degrees or above, you get charring, which is the good taste in barbecue. So for the physicists, I thought I should have some equations, but I'm not going to go through these. But just to tell you that there's a lot of work that people are interested in on the biophysical modeling of these processes to try to understand in detail how fast the energy is produced and how it distributes after it's produced. So this is for the physics people. Examples of clinical applications. This is with a ND YAG laser, so 1.06 microns, near infrared. So this is using high average power, typically tens of watts, and this is in the esophagus. So this is a patient with cancer in the esophagus, and this is an X-ray where after swallowing barium. And so you see here, there's a blockage. The tumor is going into the esophagus here and here, so the patient cannot swallow, cannot eat. So you take an optical fiber and an endoscope, you use ND YAG laser, and you basically burn your way through this. You just burn through, and you open up. It's not a cure, but the patient is able to eat and drink for some time.
I think we use the CO2 for esophagus.
Why
Now
don't
they have those fibers, waveguides.
this is a lot of tissue. You know, this is many grams of tissue. So if you use a CO2, it would take forever. Yeah, because you take off only 10 microns at a time. So you'd have to stand there and shave. I mean, it would take a very long time. Plus, you do not need the precision. Here, you're just driving through, trying to destroy the tissue. This makes a lot of smoke. So you have to have extract like air conditioner to remove it. Here is an example of lower power, enough to cook the tissue. This is an example of in treatment of patients with cancer in the liver. So here the optical fibers are placed into the tumor through the skin with ultrasound to guide the placement. So you see where the fibers are going, and you basically cook the tissue in place. So you just destroy the tumor. An example from ophthalmology. This is photocoagulation in, for example, diabetes. What's Portuguese for diabetes? It's the same thing, diabetic. Where the problem is in the retina. It causes growth of blood vessels and leakage. And so you go in with a laser, thermal laser, and you produce little coagulation spots just to close the vessels and prevent further leakage. A more recent example of a CO2 in this case is so-called transmyocardial revascularization, which is a very long term. It means punching holes in the heart. That's a very surprising thing to do, to punch holes into the heart. The reason is that in patients who have a heart attack, the muscle is often still alive, but it has poor oxygen supply, poor perfusion, so it does not work very well. And it was found if you make holes in the muscle, you actually improve the condition. Now, the question is, why does this work? When it was first introduced, people thought that what was happening is you punch a hole, this is the heart wall, through to the chamber, and so blood will flow out here and supply oxygen. But then people showed you do not have to go all the way through. This works even if you make a hole only to this depth. So you do not require blood flow. And now it's thought that what is happening is that is the damage from making the hole causes new blood vessels. So the same as when you cut your hand, you get a lot of inflammation, a lot of new blood vessels. And so it's like making controlled cuts into the tissue to stimulate new blood vessels. So that's now clinically used. Here's an example in an animal model. Patients who have burns, deep burns, one of the problems is that the healing of the tissue is prevented by the fact that the scar on top of the tissue, so you burn, then you get a scar, that scar prevents healing of the tissue. So it's nice to remove the scar. You could take a knife and do that, but then you have a worse scar at the end of it. And so here the idea is to use, again, this is a CO2 laser, to basically scan over the burn, remove the damaged, the dead tissue, and then leave the viable tissue here so that you could do a skin graft, for example. This has not yet been done clinically, and the reason is an engineering reason. The reason is that to do this over a large area, you need a high power CO2 laser, and you have to control the depth to within maybe 10 microns. Because you don't want to damage, you want to just remove the dead tissue. And imagine I have a burn and I have a 100-watt CO2 laser doing this. What happens if it stops? All right, then I got a big hole. And so the problem of how to control this is a real engineering problem that has not yet been solved. It sounds very easy, but actually it's quite difficult.
The turning point is a problem.
The turning point, yeah, this point is a problem when you reach here, and getting feedback you also have to say, when am I deep enough? So you need something like fluorescence imaging or reflectance imaging to tell you. So you need a computer-controlled, high-power laser scanning beam. Technically feasible, but not yet been done. Here's examples of thermal effect in dermatology. This is for resurfacing. Okay, this is pretty good, yeah. See, I don't care. I don't care. Nobody can see. The ladies say, wow, yeah. That's great. Be warned, there is a picture in here.
That's all.
It looks terrible. Because this is like taking sandpaper and doing this. It basically stimulates collagen. This is for just closing down these small blood vessels, and you can also use the lasers to destroy the hair follicles. Yeah, so in Toronto there are many clinics doing this, and also now doing this. Yeah. Lots of money in cosmetics. Always lots of money. Here's tissue welding. So I showed you in for photonics the laser welder for the manufacturing automobiles. So this is the same in tissue. Here is two tubes, blood vessels, welded with a laser. So this is instead of putting stitches. And this, well, it depends. So it can either be with or without so-called solder. Okay, and this can be, for example, collagen-based. So you can apply a collagen solution here and then apply the light. It works very nice for microsurgery. And also this can be done by photochemical. So there are some studies in the last 5 years using photochemistry. This is photothermal. You're producing heat welding, but you can also do photochemical welding. Selective, I mentioned selective photothermal. So here's an example. This lady has a port wine stain. This is a congenital, a birthmark. Again, these are quite common, often on the face. The clinical challenge here is how do you remove this without leaving big scars? So we could take a CO2 laser, and like in the skin, we could just scan over this. You would remove this, but the healing would be terrible. So the challenge here is, this situation is very simple from a biophysics point of view. It's simply, you have the epidermis, an abnormal layer of blood, and then the dermis. So compared with here, the difference here is that you have this thick blood layer. Question is, how do you remove this without damaging here and here? And there are two ways. One is wavelength. So we choose a wavelength which is strongly absorbed in blood, but not strongly absorbed in the other tissue. So yellow light works well, so a peak in the absorption. So that if you then look at the intensity of the light and the energy deposited, the energy absorbed, so as you go down through the epidermis, you hit the blood, and suddenly the absorption goes up. And lots of energy is deposited. You lose energy as you go through the blood. You come out of the blood here, and again, down into the dermis. So it's this selective heating that gives you the trick. The second factor is if you do it with a yellow laser, and you leave the laser on, it's terrible. Because the heat is produced in the blood, but then the heat spreads to the epidermis and the dermis. So we have to do this with pulse light. so that the energy is absorbed here, coagulates the blood before the temperature or the heat has time to spread. So this is a very good example of where you have to get the wavelength right and you have to get the pulse length right. If either of those is wrong, this does not work at all. So often, and this is variable from patient to patient, so often what is done is a little test patch where you tune the wavelength, you tune the pulse length, just to make sure that for this particular patient this works well, and if you do that, the result is spectacular, if you get it to work. If you get it wrong, you make a big mess. Okay, so this is very, the biophysics here is absolutely critical. Okay. And for example, when people started doing this, the obvious question is, why wait until the person is adult? Let's do it to the babies. Okay? Because then the baby doesn't have to grow up with the problem. And the first few babies were done, disaster. Terrible results. And the reason? The optical properties of young skin are different from the optical properties of adult skin. So the wavelength in babies is different from the wavelength in adults. And that had to be learned the hard way by making mistakes. So a nice example. Another example which you know about is tattoo removal. So we do exactly the same. We do exactly the same. In tattoos, you inject particles into the skin. You want to remove the tattoo. You want to get the same effect. And this works very nicely. And you can stop again. It doesn't flip it. This is
Change your wife.
change white. Yeah. And the women can also do this. You know, this was Fred. That joke. But if you look again, look on the internet. In some cases, this is a big mess. You remove the tattoo, but you replace it with scar. And the problem is that tattooists make up their own inks. Okay, so when you go to a tattooist, how many people have tattoos? Oh no. No? Nobody? Right. When you go to a tattooist, he makes his own. So nobody knows what it is. And so it's and there's different colors. So again, you have to do this very carefully. You do a little test, see if it works, and if not. Okay, going up, photomechanical. So now we're going to microseconds or below, and now we're talking about millions of watts per square centimeter. So it's a lot of energy per centimeter, but we're only putting it on for a microsecond. If you do that, and normally this is done in the ultraviolet or the mid-infrared, you directly break chemical bonds. So the chemical bonds absorb, the molecules absorb the photon, and the chemical bonds are broken directly. That happens very fast and very violently, and this is a micrograph, stock camera photograph of the plume of basically molecular vapor coming off the surface. So this looks terrible. Right? Huge explosion. But it can be done with incredible precision. So this is a single human hair. A single hair which is sculpted by those explosions. So we take that laser and we can make these cuts in a single human hair. They're incredibly precise. You should be very pleased that it is precise, because if you get it wrong, you produce a mess. So this is in enamel, dental enamel. So who's the dentist? Okay. How many times have you done this? I hope never. Okay, so if you use a CO2 laser on teeth, so you think, oh, a CO2 laser, that's a nice laser, I'll just zap this tooth with it. This is what you produce. You remove the enamel, but you also produce these huge cracks. So this is like taking a cup, putting it in the oven, and then dropping it into cold water. It's just thermal expansion cracks, okay, because you're depositing heat here. And so this is much hotter than this, and there's nowhere to expect. It's a hard tissue, and so it just cracks. This is with mechanical ablation. You see, you can produce a very nice controlled cut. The precision is very important because many of us have it done on our eyes. How many people have had this procedure? Everyone's too young here. So you can use those explosions on the front of your eye, on your cornea. So when you get corneal reshaping, this is your cornea. Okay, if you were to take pictures, microscopic pictures of what's happening in your eye, this is what's happening in your eye.
But the material, in the case of the X-ray laser,
Yeah?
what's coming out is different from the tissues there. Because you just destroy the double bonds and then.
Yeah, but you still still in an explosive vaporization. Yeah, sure, yeah. So there's two types. The so-called PRK, photorefractive, where you have laser pulses onto the eye, and the idea is to change the curvature of the cornea. A different technique is that you take a knife and you make a flap. You turn the front of the cornea, and then you remove the tissue inside. You put the flap back. Okay. Advantages and disadvantages each way. This is the problem is that the cornea has a layer of cells, a layer of live cells on the surface which have to regrow in this case. In this case, the cells are still here on the surface. So there's lots of arguments about this. The disadvantage of this is that the flap can come off. Okay. So this is no good if you, for example, if you're an airline pilot, you're not allowed to have this. You're allowed to have this, but not this, because of the change of pressure example. Also, if you dive, this is not good, because the cornea does not heal, so the only thing that's holding this flap on is a single layer of cells. Mm-hmm. So again, that's a problem, but people are looking at why couldn't we weld that tissue back on with photochemistry? So now people are looking at putting a photochemical here, putting the flap, and a little gentle light to do a photochemical weld so that the flap stays back. Very common. I just wanted to show you again, more from a physics point of view, that this is a very dynamic process, and it depends critically. This is time photographs in the cornea and in plastic. You see the basic phenomenon is the same, but the details are different. Lastly, let's go crazy and take the whole power of the sun that's falling on the Earth and put it onto 1 centimeter for less than a nanosecond. That's called electromechanical. And this is an example of this type of laser treatment, in this case to break up kidney stones. So stones in the kidney, you can use this type of treatment, and basically this causes explosions, massive explosions, uncontrolled, much less controlled than in the case of the PRK. The physics of this is very interesting because it involves a whole series of processes. The light is absorbed, it produces a plasma, electrified material. The plasma collapses. It produces a supersonic shock wave. The shock wave causes microbubbles to form. The bubbles collapse and produce the mechanical damage. So this, the details of this are the subject of, there are hundreds of papers in the literature trying to understand this in tissue because it's so complicated. But just to give you examples, so there's the initial events of the light absorption produces a plasma of ionized gas. The plasma collapses. It's so fast that the energy has to go somewhere, so it produces a shock wave, like a sonic boom, like the Concorde going over, a supersonic shock wave. That produces a bubble. The bubble collapses, and then you get the explosion. So very complicated physics, but very interesting. The specific parameters are critical, and it also depends on the tissue, because this is an explosive situation. So if the tissue is very strong, it is less easily removed than if the tissue is soft. I just show one example from our own lab to show that you have to get the conditions right. This is a femtosecond cutting of bone. So this is in the bone. This is cut with a nanosecond laser, and there's this thermal damage, and here's a femtosecond laser, and you see no thermal damage. So you can do this very nicely if you get the conditions correct. I thought I'd just make one statement about dentistry. Lasers are used in dentistry, as of course you know, but there's really two big challenges in dentistry. And that is that you really don't want to have a separate laser for every separate procedure. It would be nice if you had one laser and you push the button to do the particular procedure. And so this was a first attempt. This was a commercial system where they incorporated two lasers, one for hard tissue and one for soft tissue. Probably you need more than two lasers to do this. And the other problem is the cost. Because it's expensive enough to do one laser, but now you incorporate many lasers or multiple lasers, the cost becomes a problem. So dentistry is a very interesting challenge. And in fact, this system here that we're using for this, we just set up a company to try to commercialize this. The price problem is serious because dentists are so cheap that you won't pay any money to buy stuff. Okay. So we've gone all the way up here to these incredibly high powers. What about coming back down? And I mentioned finally this one. And I end here rather than starting here for a reason. So this region is the biggest use of lasers in medicine. There are more lasers sold for photobiomodulation, photostimulation, soft lasers, cold lasers, many different names. There are more of these devices sold than all the other laser systems put together. It's a complicated subject because if I take this laser, and let's say I have pain in this joint. So I take the laser and I want to treat this joint for pain. So what's happening? What's this doing? Would it work if I took this blue light and held it there? Or does it have to be red?
The blue doesn't glow as deep.
Yeah, so there are many issues here. You could talk about this for a long time. I don't want to do it, but I just want to make the point that when we do photodynamic therapy, for example, or PUVA, or bilirubin treatment, you know the target molecule. Okay, it's porphyrin or bilirubin or DNA or sorrelin, etc. So you know the target. So you can understand the photochemistry. When I do this, I have no idea what the target is. You can speculate, mitochondria, blah, blah, but really you have no idea. And it's been shown, for instance, this is in plants, this is in lettuce, that this is the taking seeds, lettuce seeds, and using light to make them start to grow. And if you do that as a function of wavelength, it's incredibly complicated. Right? So there are some wavelengths that don't do anything. There are some wavelengths that slow down the growth. There are some wavelengths that increase the growth. So what's the right wavelength? It's also the fact that if I change the power, this curve can change. So very complicated. Lots of different potential targets for this. So this field has developed in a rather strange way. It's developed from people doing very detailed laboratory work, often in cells or in plants on one side. And then on the other side, we have many practitioners who work this out empirically. So it's very different. So if you talk to some people, they say this is all nonsense. Right? This is placebo. It's psychological, whatever. On the other hand, this is very hard science. This is good science. And people use it commercially. If you're in Holland, you grow tulips in Holland, then if you decide that there will not be so many customers next week, and you have too many tulips coming into bloom, you go into the greenhouse and you turn on some blue light or some green light.
So you
suppress the growth, and then when Valentine's Day or other Easter, you put the red light on and they start to grow again. And so this is used as, this is a big business in horticulture. So there's absolutely no doubt that there is biology here that is true. But the big challenge is what is happening here. And the fact that this is used for such a wide range of applications, it's hard to think that the conditions are going to be the same here as here as here. So it's very complicated. So there are cellular studies, there's some preclinical tissue studies, and then we have the effects in patients. How many people use this among our group here? Yeah. Use it in dentistry?
Yes.
Yeah. For
therapy image dysfunction.
So how did you decide on the wavelength?
By the penetration.
So you're looking for deep
Yes.
penetration? Yeah. Yeah.
Yes.
Yeah. And
This is internal structure.
okay.
So we have to reach it.
Yeah. Yeah. Okay. And the power you adjust how?
By protocols on the literature.
Okay. Okay. So if you were to treat a different condition, would you change the wavelength and?
Yes.
Yeah. Yeah. So it's difficult.
But it's still very empirical.
It's very empirical. Yeah.
People
So
they know works and then they
yeah.
apply.
So the science, very good science here, empirical here, and
They have to
liquid.
meet someone.
They have to meet. And interesting, in the US now, the National Institutes of Health now have an institute for alternative medicine. And so they will fund
the
this.
use of low intensity lasers for a list of applications.
Yeah, yeah, yeah. So it's starting to be approved. And there's a nice book on this actually, 10 years old now by Baxter. I don't know, is there a
We
new?
have this book.
You have that one, okay. So The second area I was going to talk about is diagnostics. Maybe we should do this tomorrow.
Yes.
To start tomorrow.
Okay,
Because-
we have a coffee break waiting.
Well, but people are. Who wants to leave this till tomorrow? Hands up for tomorrow. One.
Sure.
Okay. But
You
you.
organize
you
our
want-
time already.
Yeah.
Maybe you could have a cough and so you have a chance to speak more with people.
Yeah. Okay. Okay. So we'll break now and then we'll carry on tomorrow. Okay. Good. Thank you.